Vitamin D, specifically D3. Is it the wonder vitamin that can positively impact our heart, our bones, our mood, and our immune system? Yes, it is, but it needs help from vitamin K, specifically K2. So vitamin D increases absorption of calcium in our bodies, and vitamin K makes sure it goes to the right place, to your bones and your teeth, not into your arteries. Think of calcium as the ticket to the show. Vitamin D is the admission booth. Vitamin K is the usher, making sure that Mr. Calcium goes to the right location. Again, to your bones and teeth, not your arteries. Some people call vitamin D the sunshine vitamin. Rightfully so, because when we're exposed to sunshine, our skin produces more vitamin D. Most people have heard of seasonal affective disorder, which is basically depression in locations that you wouldn't get a lot of sun exposure at during the wintertime. That's part due to lower vitamin D. So you can see how important vitamin D is for our mood. Vitamin D does a lot for our immune system, but the most interesting thing it does is modulate helper T cells. Helper T cells identify which cells are yours and which cells are foreign. That's important. You don't want your body to attack its own cells. Then you get basically an autoimmune disorder. And that's why people who have lower levels of vitamin D have a higher chance of multiple different autoimmune disorders. Unfortunately, the FDA recommends around 600 to 800 IU per day, that's international units, which is completely arbitrary term, to reach their goal of 30 nanograms per milliliter. But if you want to be healthy, you need to go with current literature, which recommends a minimum of 40 to 60 nanograms per milliliter, and they're measuring 25 hydroxy vitamin D when they measure that. Vitamin D is fat soluble, so you need to take it ideally with a fatty meal, or personally, I take it with my omega-3 supplement so it gets well absorbed whether I have a meal or not. Most people need to take about 2,000 to 5,000 IU per day to reach those optimal levels. But this is a situation where you need to know your labs. You need to be checked and you need to follow them and adjust appropriately. If you're going to start vitamin D/K supplementation, please run it past your healthcare provider to make sure it makes sense for you, especially if you're on anticoagulants like warfarin. Thank you.